talk about infrastructure for a second. The governor, you know, I think there's some folks that thought after the vote and the highway bond bill didn't pass, he would just drop the issue.
Well, it's a bipartisan idea, right? The idea of maintaining good infrastructure, sure, and also putting people to work, I agree with. Now, I represent an area in Clay County, and last I checked, we only had one project of the 250 projects on that list. So part of my concern would be make sure that we have an equitable distribution of these projects around the state, including in the area I represent.
I see an intermediary problem and a long-term problem with this plan. First of all, we're going to have to find $30 million out of the budget each of the next 15 years to pay for this. But secondly, we're now opening up the idea of always using general revenue for our roads and bridges. As far as I can tell, this is the first time that idea has real legs. And I don't want to get to the day where we see the MoDOT director and our university presidents fighting over money in the Capitol.
That's what I think.
So the Medicaid report comes out, Representative Carpenter, you've studied this state government now for 7 years. It seems to me, though, at some point you either have to do some things you've suggested, expand Medicaid, or you do have to cut the eligibility and cut people off it. How do you afford it?
For years, as you know, under the Affordable Care Act, we've been turning down billions of dollars of funding from the federal government to expand Medicaid in this state. And so, you know, I think that's mistake one that we ought to fix. We shouldn't keep saying no to billions of dollars coming into this state, which, you know, that money doesn't just come in and disappear, right? First of all, it provides health care to real people. And second of all, you know, that's going to create jobs in the healthcare industry with folks providing more health care to more people. So
we're here to honor and remember Black History Month, to pay tribute to those who tirelessly worked to better the lives of Americans in these United States, who overcame tremendous adversity to help improve our future.
And so we have to be about heightening the importance of diversity and inclusion. And so on that note, as I've been sitting in the budgetary process here in the Missouri House, I've been trying to keep a tally of a number. And the number that I've been trying to keep a tally of is how many African Americans have presented this $28 billion Missouri budget, and that number is 0.
Further discussion, lady from St. Louis County.
Thank you, Mr. Speaker. As the body can see, it's an amendment that is connected to the canteen fund, because right now we are currently selling quality feminine hygiene to women offenders. And as part of getting in line with the federal justice reform law that was just passed by Congress last year, the First Step Act, I believe it's time for Missouri to implement this health-related law. So
I learned some new things too, and one of them was, what was it, 2 tampons cost $6 from the commissary.
Right. So one of the challenges with corrections and with the federal prison system is, in order to get quality healthcare products, feminine hygiene, the quality products are only available through the canteen. The product that is provided for free is inferior, and it causes a lot of problems. So
the lady from St. Louis County has renewed her motion for the adoption of House Amendment 1. All those in favor will say aye. Any opposed will say no. And the ayes have it. You've adopted House Amendment 1.
The conversation this week that I want to talk about is actually Governor Parson's statements this morning regarding the DOR issue. You know, we've been talking for several weeks with the Department of Revenue, seeing when they're filing their taxes. And, you know, we've had lots of meetings, I think 10 plus throughout different committees, and the conversation continues to be that DOR didn't do a good job of letting the public know about these changes. There was an error, and they've changed the withholding tables multiple times. We've had a lot of questions about how we got here, who's going to be affected. We're still not getting a lot of answers, and just this morning the governor made a statement that essentially it's the fault of Missourians for not switching their W-4s, and this is just how it is, and that legislators are grandstanding over this. I find that insulting. I'm not grandstanding when I'm saying that our Missourians deserve a little help when the Department of Revenue has admitted that they made a mistake, and now folks are facing surprise tax bills. I think we should be doing more to help them.